Welcome to Infectious Disease Assignment Activity Unit 6. Today, I'm going to talk about comparing HIV and the human papillovirus HPV, transmission, symptoms, treatment, and public health in Tanzania. My name is Daniel Kimel. STI comparison and transmission. Human immunodeficiency virus, HIV, tends to spread through unprotected sexual intercourse, transmitted through infectious blood, contaminated needles, and from mother to child during pregnancy, childbirth, or breastfeeding. HIV is not spread or spread through casual contact such as hugging, sharing food, or mosquito bites. Human papillovirus, HPV, spreads majorly or mainly through skin to skin sexual contact, including vaginal, anal, or oral sex. Many infected individuals have no symptoms but can still transmit the virus. When you make the comparison, both HIV and HPV are sexually transmitted infections. HIV attacks the immune system, whereas HPV infects the skin and the mucous membranes. HPV can be prevented through vaccinations, while HIV prevention includes condom use, HIV testing, and a pre-exposure prophylaxis. This is a difference between the two. HIV symptoms, treatment, and myths. There are symptoms like early flu, like illnesses, fever, fatigue, swollen limbs, lymph nodes, and weight loss during advanced disease stage. Treatment can be a lifelong and retroviral therapy, ART, which suppresses the virus and enables people to live with HIV healthy lives. Common myths. People believe HIV is a death sentence, but the fact is that early treatment and consistent ARTs allows many people to live long and healthy lives. HPV symptoms sometimes or often no symptoms, and others are like genital warts. Persistent infections may lead to cervical, anal, or penile and throat cancer. The treatment of HPV, there is no cure for itself, but the treatment focuses on removing warts, treating precancerous changes. HPV vaccinations and cervical cancer screening are highly effective prevention strategies. Common myth: only women get HPV, but the fact is that HPV infects both males and females who also can transmit the virus. Public health campaign and social factors. In my country, they have implemented several public health campaigns promoting HIV testing, condom use, prevention of mother-to-child transmission, PMTCT, voluntary medical male circumcision, and access to antiretroviral treatments. HPV awareness has also increased through school-based vaccination program for girls and cervical cancer screening services. Despite these efforts, stigma remains a major barrier. Some individuals fear discrimination if they seek HIV testing or disclose their status. Cultural beliefs and religious values sometimes discourages open discussions about sexual health, especially among young people. Parents and teachers may avoid discussing sexual transmitted infections, leaving adolescents vulnerable and misinformation. The country has also introduced HPV vaccination for adolescent girls and expanded cervical cancer screening services. However, stigma, cultural beliefs, and religious values may discourage people from discussing sexual health openly or seeking HIV testing and treatments. Globally, countries such as Australia have demonstrated that combining HIV vaccination with regular cervical cancer screening significantly reduces HPV infection and cervical cancer rates. Tanzania can continue strengthening similar approaches while adapting them to local cultural values. Proposed based evidence based solutions. Community based STI education through schools and faith organizations. An effective strategy would be to strengthen partnership between healthcare providers, schools, churches, and community leaders to deliver culturally appropriate STI education. Uh, the program comprises the following: age appropriate sexual health education, community discussion led by trained healthcare workers, promotion of HIV testing and HPV vaccination, education that reduces stigma while respecting cultural and religious values, distributions of cultural educational materials in Swahili and English. Research indicates that community-based education combined with accessible testing and vaccination improves awareness, promotes early diagnosis, and reduces STI transmission. Thank you very much for listening and watching.